I would say that a conference like Doctors to and You that brings together all, I would not say stakeholders in healthcare, I would say partners in healthcare, is a great occasion to exchange views on a European and a global environment. Because till now, this kind of conferences was available only in the US, and it's good that we have it here in Europe and we don't need to travel so far away. Health 2 is about information and communication technologies in healthcare. How technology can help us have better healthcare and manage our health ourselves. You might have heard terms like telemedicine, or you might have downloaded in your mobile telephone some applications that help you monitor your health. This is eHealth. I am a breast cancer survivor, and I try to present in my blog and in my involvement with social media aspects like health technology assessment, participatory medicine, shared decision making in healthcare, how applications and platforms can help us patients in chronic disease better monitor our healthcare. In Greece, e-health is very low, despite the fact that the Digital Agenda 2020 policy of the European Union makes an accent on e-health and information and communication technologies that will enable EU citizens to better use information in their everyday life. In Greece, the only e-health application we have now running on a national scale is the e-prescription, and this is an initiative that started only last year and covers not all of healthcare, but only some of the social insurance funds, where doctors are obliged to write their prescriptions online. There are patient communities, but they are rather static. They have websites, and this is a new development, but they are not active in forums, in patient communities. They do not communicate. There is very little communication among patients on the internet in Greece. Patient advocacy, it's strong, but it is rather offline, as it is in most European countries. Online patient advocacy in Europe is something new, and patients have to learn about it slowly. As an active user of health information on the internet, I would suggest to patients that are newly diagnosed to follow these steps. First, go to online trustworthy sites about their disease. These sites are like the PubMed, the NHS site in the UK, or other national health care sites in their country. Read up all they can about their disease. Take notes. Then try to meet other patients with same disease online. Exchange information about their symptoms and how they feel, medicines, therapies. Note that down too. After they go for their second appointment to their doctor, prepare very well for this appointment. That is, make a list of all the questions you have for the doctor, questions that arise from what you have learned in the meantime. Write down all the medicines you may take, any other previous diseases you had, any operations you might had. And talk frankly to your doctor about your findings on the internet. If your doctor does not like to hear about your findings and does not want to discuss your worries or your questions, I would say you might try another doctor if you have this possibility, or try to convince him that what you're saying is right and has a basis. But for this, you have to do very well your homework first. Don't take no for an answer, because there are many options which doctors might not be aware of, because each doctor knows what happens in his own broader specialty. He might not know what happens in your very little area of your own specific disease. There are very good examples of patients who have found information, very valuable information online through other patients. I would just mention the case of David Broncar, who was condemned with renal cancer disease, advanced renal disease, and going into the core community, into renal cancer community, he got information from other patients that there were 4 other specialist doctors in the US with whom he could consult about options for his own case. That's what he did, and that's how he is alive today. He took a very difficult therapy, but he had the possibility to learn about it. So don't overestimate. Internet is not everything, but also it is not nothing, like some doctors would like to convince us. I think we are moving into the big data area and into the quantified self. That is, more and more patients will try to make their data visualized, because they see that the appointment time in many countries is reduced to 10 minutes. In 10 minutes, the doctor does not have the time to go through a bunch of papers and a bunch of CTs, MRIs, and the like. If you have everything neatly packed into one-page sheet with graphs, the doctor can see the trends and he can grasp immediately what is the case with you, which is not possible with all the paperwork you bring with you at the medical appointment. The patient advocacy groups in Europe have to move from the plain support among peers, that is, till now, towards new fields like e-health and healthcare advocacy. My role, I think, in the future has to move to explain all these concepts that are difficult and are non-existent in our medical deliveries, shared decision-making, health technology assessment, informed consent. These are not existent. E-health, how to use health applications, what e-prescription does, what the electronic patient record does, all this is brand new. And it needs repeating and repeating and explaining so that more and more patients can catch on.